Friday, Baylor College of Medicine and friends of Baylor. Well, this is our famous Q&A. It's what my sister waits for because she sends me so many questions and I always say, oh, I'll get to them. But we're going to get to them today. So lots of questions. I'm just going to take the ones that seem to be the most on your minds. Got a lot of questions for people. Okay, number one, do you expect more variants to appear from Omicron? As long as the virus is replicating, we're going to see more variants. There's a 100% chance that we will have more variants. Whether they're worse or better, we don't know. But there will be variants, and I'm sure that will take place over the next year or so. What are your thoughts on a second booster, a third or fourth shot, or fourth shot, in other words? Well, as you know, the FDA and now the CDC have approved the fourth shot or a second booster for those over the age of 50. I kind of wish they just approved it for everybody, but right now, only about 20% of the nation has even gotten a first booster. So I still think we need to focus on getting boosters to the other 80% of the country and vaccinations to people who've been unvaccinated. But if you've been a good person and you got vaccinated and you got your booster, you can get a second booster starting 4 months after your first booster. I personally am going to probably wait for a month or two because right now in the United States there's very low rates of infection. And so we're likely to see a little bit of a bump up in the late spring. We're definitely going to see a bump up in the fall. So I'd rather be ready for that. So I'm probably going to delay a little bit and then get one. But if I were traveling to Europe, which is another question, because Europe is having a surge, I would go ahead and get a booster before traveling to Europe, the second booster. So the third question is safe to travel. Yes, it's safe to travel anywhere in the United States. Internationally, well, there are, I told you the countries last week, Australia, Chile, Europe, parts of China, Shanghai in particular, and Hong Kong are having, peaks, or having little surges. I think they're going to start coming down in Europe over the next couple of weeks. And so if I were going to Europe, I think it's probably safe to go. Just check what the requirements are. Most of Europe is opened up now. There are very few restrictions. So in that case, I probably would want to be sure I got my second booster before going. I like this one. Will you still wear a mask on an airplane when the mandate is lifted? I'm probably going to. I kind of like the idea of, not having people sneezing and coughing on you. And I think it's, the evidence was really clear that once the mask mandate was put in place, there were no outbreaks on planes. And before that, there had been. In international flights in particular, there had been one. I reported on the Israeli flight to Europe, and there was one in European flight to the Middle East. There were outbreaks. And so I would probably continue to wear a mask on airplanes, even when it's over. I wish they'd keep it, actually. I think it's better for people. Here's an interesting one. What classifies a pandemic being over? Really good question. Well, the definition of a pandemic is really, widespread infection that is geographically dispersed throughout the country, or across the world. Some people include that there's major disruptions in social and economic conditions. But usually you recognize the pandemic being over in retrospect. So we'll kind of know it's over when we know it's over. When it's no longer going all around the world, it starts disappearing and becomes just a seasonal, infection, that'll be when it's over. But we're still in the midst of a pandemic. There's no getting around it. We're still having, peaks all over and surges all over the world. We still have active replication in various parts, so we're still in the middle of a pandemic. Here's an interesting one. Has the pandemic had an impact on our immune system? Has mask wearing lowered our immunity to the common cold and things like that? Well, the answer to that is no, our immune system is perfectly intact. What has happened is because we're wearing masks, we've gotten a lot fewer respiratory infections. There's been a reduction in respiratory syncytial virus, parainfluenza, influenza, for example, has been very low because of wearing masks. Common cold is coming back as we take masks off. And so you don't have a loss of immunity. I mean, we're all doing fine. We're all ready to go. It's just that we've been wearing masks that prevent other respiratory pathogens. The best way for you to have your immune system boosted, which is people ask a lot, what can I do to boost my immune system? Get a vaccine. Vaccine is absolutely the best way to boost your immune system against the virus. So get your flu vaccine, get your SARS-CoV-2 vaccine, get your vaccines up to date. That's the way you boost your immune system. By the way, there was a large study with ivermectin, finally a widespread clinical trial done showing no benefit. I've had that question a couple of times. What about ivermectin? Did it ever show to be useful? A couple of studies did kind of suggest it, but they were never randomized control studies. A large study showed ivermectin has no value. Some friends and family with young children have asked, why is Florida recommending that young children do not get COVID vaccines? Well, it's because they're wrong. They're wrong. You know, the statement from the governor and from the head of the public health there was, well, kids aren't that affected by it. Well, there's a ton of data now that COVID causes long-standing problems in a number of people. Why would you ever want to have a kid to be exposed to a virus they don't need to be? So I don't want to say it was stupid, but it's stupid. Stupid. It's stupid. Is COVID vaccine dangerous for a child who has had multi-system inflammatory syndrome, MISC? So this is a rare complication in kids. It hasn't been seen that often, but occasionally kids have had a real sort of systemic response that's been very, very serious. There's been very little real studies to look at the safety of vaccines, but right now the majority of experts in the field feel that those patients would probably do well to get vaccinated because it would prevent them from being reinfected. The MISC is caused by infection, so the idea is get a vaccine to help prevent reinfection. But there's not really enough kids to study this in a randomized way. But the answer is if it was my kid, I'd get him vaccinated. It's my sister. When's it going to safe for you to go to Italy? Just go to Italy, Janet. I mean, just go to Italy. Get your second booster and go to Italy. Here's one. Have you changed your mind on the origin of the SARS-CoV-2? No. I have not changed my mind. Now, we did review a paper a couple weeks ago that there may have been 2 transition species. So we know it's zoonosis in horseshoe bats. We think, based on work from our scientists here at Baylor, that it probably jumped into pangolins because the spike protein is 99.9% similar to the pangolin spike protein. It may have had another intermediate species, whether it was a deer or a fox, but we now know white-tailed deer are spreading it. There's one guy in Canada that got it from a white-tailed deer. Don't ask me how. I've been trying to figure out how did he get it? Well, we won't go to that. But yes, I think it's the same. I still believe it's a zoonosis. Horseshoe bats jumping into pangolin and then maybe another species, but then it was transmitted from the wet markets in Hunan. I think that's pretty clear. It was a really good study we talked about three weeks ago. What are the most frequently seen long-term COVID symptoms? Well, there's a lot, actually. There's been sort of brain fog, cognitive impairment. There's been problems with persistent shortness of breath, so the lungs are damaged. We reviewed the data from last week. Cardiac complications are pretty significant. In the VA study of several 100,000 people, there was about 40 to 50 cases of cardiovascular complications per 1,000 people, but it was about a 40 to 50% increase over the control group. So clearly COVID can lead to cardiac problems. There's been a bunch of other symptoms as well. Somebody asked about is there a connection between neurologic disease and stroke, and there about 1% of patients, if they looked at stroke, it was related to COVID. An 8,000 patient study, they had 100 patients who developed a stroke around the time of COVID. It's not very common, but it was higher than what you would have expected. So there is a stroke risk. That stroke risk lasts for 3 days around the time you're infected. After that, there's no real risk. What long-term mental health issues are being seen in kids? Well, our chair of pediatrics, who specializes in this, had a really nice study on this and talked about the mental health complications. But certainly isolation, being at home, the social distancing has been a real problem for kids. So there's been significant mental health issues around kids being taken out of school. And so that's why we push, kids need to be in school, so let's adults behave appropriately. let them wear masks in school. But it's good to have them in school. We need to have kids in school. There's a good question about pregnant women. They have a higher rate of complications with COVID. And yes, there's about a twofold increase in complications in patients who are pregnant and get COVID. And by the way, there have been a bunch of studies looking at vaccination in pregnancy. There's no risk at all. So again, one of these myths people are worried about, if you're pregnant, get vaccinated. I mean, 100% get vaccinated. And so those were the main issues that people had this week. Next week, we're going to come back and review all the data as we normally do, but this week I thought I'd just take some time to answer the questions you have. So hope that was useful. Again, these are my opinions only. These are not from the home office. These are Paul Klotman's opinions as a physician and trying to help you all, and particularly my sister and her friends, understand what's going on. So hope you have a great weekend. I can't wait to see you.